Hello, everyone. Welcome and thank you for joining us today. I'm Hallie Nicholson, HR Strategic Communication and Engagement Manager, and I'll be your moderator for this town hall. It's great to be here together this afternoon. We've got a great group of panelists with us today to provide some updates on our operations during the COVID-19 pandemic and to answer questions about topics that are important to staff. Some of the questions were submitted during registration, and you can also feel free to use the Q&A window to submit additional questions for our panelists. We've got panelists behind the scenes as well answering questions in writing, so I do encourage you to check out that Q&A box. Due to our time limitation, we won't be able to get to all your questions, but we will log the questions as they come in and post the answers on our Return to Learn website. This webinar has live closed captioning in two ways. First, you can click on the closed caption button at the bottom of your screen and select Show Subtitles, or you can also click on the link that will be pasted into the chat. So now I'd like to introduce our first presenter, Dr. Chip Schooley, Professor of Medicine, who's going to give us an update on the medical side of things of COVID-19. So take it away, Chip.
Thanks very much, Hallie, and welcome everybody. It's good to be back with you today. I'm going to try over the next couple of minutes just to give a brief update, and we'll have some time for question and answers later. I think as everyone has been seeing, we're seeing the current wave of mainly the Delta variant in the US declining. We've been on the downswing now for about 2 weeks or so, and I think are headed in the right direction, particularly here, next slide, in California. You can see that if you look at California, we never really had the types of peaks that were seen in the southeastern US, and even from the modest peak we had, we're seeing things improve throughout most of California, particularly here, as I'll show you in the San Diego region. Next slide. There's still some issues with children. We've had the largest wave of pediatric infections since the beginning of the epidemic over the course of the last month and a half. Much of this has been driven by schools reopening, particularly in the Southeast over the last 6 weeks, where masks were not required in several of the key states. This fortunately is getting better as well as masking mandates are being come in place, and some of the other school systems are opening in other parts of the country with mask mandates. Next slide. In San Diego, things are continuing to improve. You can see in the upper left panel that the number of cases has been declining for about 4 weeks, and we're now down to a case rate that looks very much like the what we were seeing toward the end of April. And the number of hospitalizations, which often follows the case rate a bit, is also declining very nicely, both here at UC San Diego and throughout the county. If you look in the lower right-hand panel, you can see, though, that continues to be this dichotomy in terms of the characteristics of people who are in the hospital. You can see that at UC San Diego Health yesterday morning, we had 54 people in the hospital. 46 of these were people who had not been vaccinated. 8 were fully vaccinated. Several of them had other conditions that contributed to their hospitalization. But if you look in the intensive care unit, all of the patients in the ICU were among the non-vaccinated population. So what we're continuing to see is the severe disease accumulating in people who have not been vaccinated. Next slide. And to show you what's going on campus, if you just focus on the middle panel, you can see that we are having generally a pretty good situation as our students arrive back on campus. We put 13,000 students, or a little over 12,000 students in beds, and had a campus positivity rate of 0.1%. You'll hear a little bit more about this from Dr. Socher, who follows me. The campus employee case rate is also quite low, which is very reassuring, and very happy, no cases at all. Day before yesterday, to give you a sense of how things are quieting down here as well. Next slide. Now, why are things getting better? A lot of it is that in other parts of the country, people who had kind of resumed activities indoors and in places where the transmission rate was high, backed off a bit and began to mask indoors and in crowded outdoor situations. And workplaces have gotten better at helping identify people through screening and isolating them and quarantining their contacts until the incubation period is over. But the most important thing has been we're gradually seeing an increasing level of immunity in our populations at risk. More people have been infected in the past, but more importantly, we have an increasing vaccination rate. Next slide. Particularly here in San Diego, you can see that we're close to 90% of San Diegans have, over the age of 12, have had at least one of their vaccine shots. And you can see that a little over 3/4 have already had 2 of them. When you look on campus, our students are coming in above 90% have gotten started. You'll hear a bit more about this situation from Dr. Sosha in a minute or two, but we're very happy with how our students are coming in. We think they'll be several points higher as some of the records get reconciled. On the health sciences campus, we're in the close to 95% of our employees have been vaccinated. As you know, there's a state mandate that goes into effect later this week. You'll hear more about that for health science employees by the CDPH, the Department of Health, which requires vaccination or an exemption. Campus employees are under the UC San Diego mandate, which is coming along as well. You'll hear more about this from Terry Winbush, but you can see that our employees are doing well as well, with about 90% of them started and 88% fully vaccinated. Next slide, please. Now, to get to the kind of discussion of the day, booster shots, what's going on here? Well, what we're seeing right now is that the 3 vaccines in use are doing a pretty good job of keeping people out of the hospital and preventing deaths. We're seeing a fair number of breakthrough infections. We're seeing more breakthrough infections in people who received the Pfizer vaccine than the Moderna vaccine. And that's perhaps because the Pfizer vaccine was given a bit earlier, perhaps because it was given 3 weeks apart instead of 4 weeks apart. But the bottom line is we're seeing more of an erosion in the Pfizer immunity from the standpoint of breakthrough cases than we are in the Moderna situation. We had fewer people vaccinated with Johnson & Johnson, but we think we're going to see more breakthrough infections with it coming along as well. A lot of discussions have gone on about booster shots. Why do we want to boost people? Obviously, we want to do as much as we can to reduce morbidity and mortality. People who are immunocompromised, transplant patients, and others have been offered booster shots for some time now. 3rd vaccine, and many of them seems to provide quite a bit more protection. We also want to decrease transmission so that fewer people transmit virus to unvaccinated people at home and their families and out and about. There's long discussion about this at the FDA that we'll discuss and at the CDC that we'll discuss in a minute. But the bottom line is I think boosters are going to be picking up steam over the course of the next few months to try to keep us ahead of having waning immunity get us in trouble. Now, next slide. What about this issue of booster shots? This just shows you the schedule of Pfizer and Moderna and Johnson & Johnson vaccines. Weeks 0 and 3 with the Pfizer vaccine, 0 and 4 the Moderna vaccine, and there was only 1 shot given for the Johnson & Johnson vaccine. Normally, our primary booster vaccination series for many of our diseases are given 0 weeks, 4 weeks, and then 16 or 20 weeks later. We didn't do that with this particular virus, and it was mainly because I think we didn't spend a year and a half or 2 years trying to sort out the perfect schedule because of the emergency that was underway last fall when this was all happening. But it's clear now that this vaccine as well needs that delayed booster shot just like others do. And we're headed in the direction, as I said, for boosters. Next slide. As you saw the last few days, there has been an ongoing discussion in the late stages of the booster shots related to the Pfizer vaccine in particular, because it's the only one that has been far enough along to get to the Advisory Committee on Immunization Practice, the ACIP, at the CDC. The steps that vaccine manufacturers have to go through are to first finish their studies, then they show their studies to the FDA. The FDA has a group called CBER that evaluates it. They have an outside committee called VRBPAC that then gives them advice to the FDA commissioner, who then decides whether or not a vaccine should be approved for the indications that the manufacturer requests. In the case of the Pfizer vaccine, Pfizer asked that anybody over the age of 16 should be allowed to have a booster shot. After going through the FDA process, the FDA commissioner said that she thought that the vaccine should be available to people over the age of 65, people with underlying conditions themselves, and people who were in jobs or work situations in which they would be in contact with people at significant risk, which would be healthcare workers and teachers. It then went from there to the CDC. Their outside committee was much more conservative and did not recommend vaccination of healthcare workers or teachers. But Dr. Rochelle Walensky, who had recently been the head of infectious diseases at Mass General, and understood the problems with breakthrough infections, the impact on the workplace, and understood the trends and things, reversed that decision, and the CDC has approved the vaccine the same way the FDA did. Next slide. So where are we now in terms of timelines? We're now in a stage where we're going to be offering booster vaccinations to people over the age of 65 and those who are either at risk themselves or in at-risk conditions if you receive the Pfizer vaccine. Those of you who get your health care at UC San Diego Health and fit the medical conditions will be can schedule through MyChart. There'll be more details later about some of the other boosting for employees who meet other criteria. Today, the Pfizer vaccine for children was submitted to the FDA. I expect we'll hear from the FDA about children 5 to 11 sometime by the end of next month. Booster shots for those over 16 are a little bit further out with the Pfizer vaccine. Not completely clear when this will be. It may be closer to the end of the year. A lot of the research is now well underway for children 2 to 5. And again, I'd not be surprised to see these vaccines available by the end of the year. Children are getting smaller doses of the Pfizer vaccine, about a third of the dose given to children 5 to 11, and the tolerability has been quite good, as has been the immunogenicity. The Moderna vaccine is holding up a bit better, and so there's less urgency in getting the boosters going. Moderna has also done their booster research, and in their case, they're recommending the booster shots be half the dose of the initial 2 vaccinations. And I think you'll see them coming along sometime in the middle of October, later before the middle of November, with the same kind of booster recommendations as Pfizer. Children a bit further along, and J&J is a bit behind the other 2. So I'm going to stop now and turn this back over to my colleagues and look forward to interacting with you all with questions later.
All right, thanks a bunch, Chip. Always great to hear from you. All right, so for our next update, we're going to hear about some campus health and safety guidelines from Dr. Angela Sosha, Interim Executive Director of Student Health and Wellbeing and Chair of the Vaccination Mandate Work Group. So Angela, take it away.
Hi, and thanks, Hallie, and good afternoon, everyone. So we have some new updates that reflect a lot of activity, including what's been going on with the mandate, as well as taking into account the Delta variant, which is the virus that is circulating in San Diego and has a more rapid transmission. And we know we have some breakthrough cases. You're going to see we have some changes in policy. So we're going to review all of that this afternoon. So the mandate basically is asking all UCOP individuals, students, faculty, and staff to be fully vaccinated, which means you've completed your series. Does not take into account boosters at this point. So boosters are not part of the mandate. Fully vaccinated to accept you complete your series or an approved exemption. And these include medical, disability, religious, as well as a deferral for pregnancy. The CDPH has, as Chip mentioned, made an additional mandate for healthcare workers that they be fully vaccinated or meet some exemptions. They have a more restrictive exemption criteria. They do not recommend it or they do not allow a deferral for pregnancy. And as we heard at the last town hall, it is actually encouraged that pregnant women do vaccinate. There are some health benefits to it. They also do not have an exemption for recent COVID infections or a positive antibody. So there are more restrictions on the CDPH requirement for healthcare workers that does go into effect. You saw the numbers. We're doing very well in all of our populations, with a large percent being vaccinated, as well as then a few percent meeting the criteria for the exemptions. And we are reaching out to anybody in the gap. Why do we still have a gap? There are actually some challenges in the data. It can be tricky. The students are gradually enrolling, and enrollment has gone up as students pay their fees. We have employees who sever and terminate. We have retirees. There are a lot of different categories, but as best we can, we're working through all of that. Also, employees have to consent. So we've seen frequently employees, we have evidence in their employee health record that they have been vaccinated, but they've not done the two-step of review and consent and submit the approval to share that vaccine to meet the mandate. So please, if you haven't done that, please do that. So we're working on that as well. And then we have the international vaccines for our students generally, which are a little more complex to review and then approve meeting the criteria. And we do offer some supplemental vaccination because some of the international vaccines are not as protective. Vaccination is still available for primary vaccination at the Price Center for both employees and students. We're not doing boosters at the Price Center, but if you meet the criteria and you are a UC San Diego a patient, you should have actually gotten a message. It's very easy. I met criteria by age and my employment, and I got my vaccine in the Athena Center. It's drive up, super easy. Their appointments are available if you meet the criteria. I think there is a little confusion about the education. My understanding, and Chip will certainly correct me if I've got this wrong, is it's been for younger educators, not for higher ed educators. They have not been brought under the Pfizer WHO at this point. I think things will expand and more populations will be allowed to have access to booster with time. And it's possible we'll have it on campus, but right now, the easiest way to get a booster, if you meet criteria, is going to be in the health system that you receive your care. Next slide. And also a comment, flu vaccine is widely available. We do not yet have an official mandate. We anticipate it may come, and it will likely be a self-attestation. I would take advantage of flu vaccine. You can get it at any pharmacy and your healthcare providers. At the Price Center, we're offering it for students. We are hoping to get an allocation for employees, but that may not occur for a few weeks. So I wouldn't delay waiting for the Price Center access. Take advantage of it throughout the community. Lots of flu vaccine around. Next slide. Let me cover this. If you do have an approved exemption or you're not yet fully vaccinated, maybe you've only gotten your first dose and not completed your series, you need to follow, as part of the mandate, the non-pharmaceutical interventions, which are basically testing and masking. And I'll be describing that in quite a bit of detail. The testing for the unvaccinated community throughout the fall quarter will be twice a week. So that's surveillance testing. If you are unvaccinated, it is required of employees as well as students. Remember, last year, employees were encouraged but not required. Under the mandate, unvaccinated employees are required to test twice a week if they are coming onto campus. Next slide. So we've had some changes in the exposure guidance, and this is very important for employment. It's partly related to the duration of quarantine because Delta tends to have an onset that is sooner. And so people convert, and we want to pick up conversions fairly soon. So if you are an unvaccinated individual and you have been notified by public health, either our own team or the county's team or another provider has told you that you meet criteria, it's not a self-definition, that you have been exposed and you're unvaccinated, you need to remain off campus. If you're a residential student living with other non-family members, you'll be moved to quarantine housing. You need to test upon notification and then get a day 5 test post-exposure. If those 2 tests are negative and you monitor your symptoms throughout this period, a period of 7 days, then you have completed that quarantine. Keep monitoring your symptoms. Everybody should do daily symptom monitoring. That's part of our normal life now. If you're an employee, though, that period of quarantine for work function is extended to 10 days. So Cal OSHA does not allow unvaccinated employees after an exposure to return to work until a full 10-day period and no development of symptoms. If you're a vaccinated employee, now you are allowed to actually continue to work even though you've been exposed. This is something the healthcare workers have been doing through a large part of the pandemic. If you don't have symptoms and you've been fully vaccinated, you are allowed to continue to work, but we are adding some added safety precautions. In addition to the regular indoor masking, if you've been exposed, we want you to mask at all times, including outdoor spaces. When you eat, please eat alone. Residential students who have a roommate, because we have doubles, if they have an individual they're sharing a room with because they don't mask at night to sleep, they are being moved to quarantine housing. But they are able to actually come back and do classes. They are able to, as student employees, to work. This is if you've been vaccinated and you have no symptoms. You still need to test on notification of exposure in day 5. And that period of monitoring, again, very strict monitoring, goes for 10 days as an employee. So changes in the quarantine process this fall. Next slide. So masking, just to remind everybody, regardless of your vaccination, we are in indoor masking, except if you're in a personal enclosed office by yourself and you've not been exposed. There's no eating or drinking in the common indoor areas. You are allowed to do that again if you are by yourself, only in your enclosed personal office. Outdoors, we encourage everyone to mask in crowded situations. And remember, the exposed, vaccinated employees and students need to be masked for that period of time. Students living on campus, we had a great move-in, as Dr. Scully mentioned to you. Over 12,000 students moved in over a 10-day period. Anybody on campus had to be aware of this incredibly exciting period. They did a great job. There were only 13 students who arrived unaware of an infection. Asymptomatic students picked up very quickly and moved to isolation housing. That positivity rate of 0.1 is substantially less than we expected and better than many sister campuses in the system. So they've done great. They continue to mask in their common areas, but they don't need to mask in their bedroom or when they shower. In a couple weeks, if things are looking really good, we will allow them to start not having to mask in their residential units. This just gives them a little more normal life experience like we are doing in our homes. Most of us are not masking in our homes. It's an easier way to live. It's a more normal way to live. So they also are not visiting between units. So the student behavior has been very good on campus, and we're really excited about the way things have started out. Next slide. So masking, just a reminder, a mask is not a scarf or a bandana. It's not a ski mask or gaiter or a collar. It's not putting your arm in front of your face when you walk by someone. It's also not the shields. The shields do not alone work as a good mask. A mask needs to cover both your nose and your mouth. It needs to be tightly fitting. We're recommending N95s or KN95s or a surgical mask or multi-layer cloth mask. But again, what's important is the tight fit around your face, okay? And that you tighten it up around the nose. This is an important part, no gaps on the side. Some folks like to put a surgical mask followed by a cloth mask over it. That works really well as well. And then you can readily get the KN95s and the N95s, and we're making those available to campus employees. Next slide. Testing. So there are certain things, regardless of your vaccination status. If you have the new onset of symptoms, we're going to recommend that you get a test. Remember, the campus has provided free testing and access to testing to make it really easy for our employees and our community to test. Wastewater. If there is a wastewater signal in a building that you work in, we encourage you to test. For our residential students, if they're living in a building with a wastewater signal, we're requiring them to test within 48 hours. And again, if you've been notified that you've had an exposure, a close contact with someone who is positive, you should test when you're notified and then on day 5. Unvaccinated individuals throughout the fall quarter will have surveillance. That means no symptoms, just you test consistently twice a week, no less than 3 days, no more than 5 days apart. So for the fall quarter, if you are an unvaccinated individual or partially vaccinated, twice a week testing. If you're a vaccinated individual, for the students for the first 4 weeks, we're requiring you to test if you're coming to campus. And we're encouraging our employees to do the same thing. This will give us a very good feel if we're seeing any asymptomatic shedding of virus, if there's more virus than we're able to see based on other criteria. So after 4 weeks, we're going to reassess things. So keep your eyes open for another update at the next town hall. And please take advantage of all the testing. I want to remind, next slide. We'll get there. Oh, before we get the vending machines, I want to remind folks about the daily screening. We are going to do an update. It's going to take us about 2 weeks to get all the infrastructure built. We're going to simplify the thumb process so that when you do your daily screen, it'll be very similar to what you're doing when you log in. You'll answer the same questions about exposure and symptoms. But we're also going to integrate information about testing requirements for unvaccinated. We're going to bring all of that together and create a very simplified symbol. Green, you're allowed on campus. Yellow, you're allowed on campus, but you need to do that continuous outdoor masking and you need to eat alone. Or red, you're not allowed on campus. And that could be a variety of reasons. You're not following the testing requirements that are present. You are developed some new symptoms. These are things that could give you a red thumb. So you will see this new form of the thumb coming out in a couple weeks. We think this will make it easier for everyone. Next slide. Remember the wastewater signals on the Return to Learn dashboard. You can see any building that you work in. You'll be able to tell if there's been a recent signal. If there has been, please test. You also may be receiving the targeted messages when we have wastewater signals. Next slide. And the vending machines. So vending machines processes worked extremely well. Employees, for your very first COVID test, that cannot be through a vending machine. Can be at the price center or drive up site in the health system. If you've ever had that done once, you're in the system, you can then go on and use the vending machines. You do need your campus ID to release a kit. The kit is then released from the machine. There is a $1 on, $1 off. So it'll look like $1, but it comes right off behind the scenes. So no cost. And the kit will contain everything you need. It'll have instructions, a swab, and a testing vial. What's really important is we have to identify that test to you. And we do this through the UCSD app. On the UCSD app, you go in with your AD logon and you scan a barcode on the vial, just like all the barcodes we're used to in our grocery stores and everywhere else in our world. You scan that vial on your phone, it will link to you because you've been logged in as you through the app. You'll see that it's captured the barcode. Make sure you capture the barcode, and then that vial is now linked to you. After you've swabbed, you drop it into the collection bin. We just need the vial dropped in. Please return the clamshell because we recycle those. You should get your results within 24 hours. If you don't get a result, please retest. Every once in a while, we have a slip in the barcode capture. Every once in a while, make sure you do seal the vial. Sometimes somebody doesn't seal the vial and the media leaks out. We also have occasionally seen someone put the swab in upside down. Make sure the tip that you swab your nose goes in first, so it's sitting in the media. But for sometimes there can be a loss of a sample or something odd. It's very rare. We do thousands of samples and it's unusual for us not to get a result. But if you don't have a result in your MyChart within 24 hours, please retest. And if you're still not seeing it, call the COVID testing line or call Student Health if you're a student. The vending machines are in 20 locations throughout campus with 2 drive-ups, one at Osler, and I think by the end of this week, there'll be also the North Torrey Pines. So make sure you do the swabbing. The pickups end after 2 p.m. So please get it in early in the day so we can get results either back that evening or early the next morning. Next slide. Just again, a reminder, you do want to load your UCSD app on there. You have to make sure you capture the barcode on that part. Thanks. Next slide. And the other thing, take advantage of the Cal Notify app. This is another way to be notified of an exposure using the Bluetooth technology. If you are positive, we'll be giving a code that goes into your phone, and then everyone who's been within that perimeter of contact will get a notification of exposure. You will call COEM or you will call the student health team and we'll give you further guidance. So this is a helpful tool in our managing exposures. Next slide. And yep. Okay, I think we're going to have a transition now, and Terry's going to help out here.
Yes, thank you so much, Dr. Sosha. So as you mentioned, next up, we're going to hear from the return to campus side of things, vaccine policy side of things, from Terry Winbush, Senior Director of Labor Relations and Employee Relations. So Terry, it's all you.
Thank you, Hallie, and thank you, Angela. So many of you would like to know some return to campus updates. So first thing, you should know that the UC provided emergency paid sick leave has been extended through June 30th of next year. So the allotment of the amount of leave, the 80 hours, has not been increased. However, the ability to use it has been extended through June 30th of next year. Once we have final details on any revisions to this paid leave, we will make sure that they're on the website and communicated out broadly to you all. Additionally, the Office of the President extended the vacation overmax allowance for policy covered employees to be able to use their vacation accruals through June 30th of 2022. I am sharing that information to you because that has been changed. However, please take vacation. Please take time to refresh yourself. Please take that time because it's beneficial for you, your mental health, your physical health, and all those things. But it's also beneficial to your work. It's beneficial to your colleagues to have a more rested and refreshed, better version of you. So please take the time off to take care of yourself. As it relates to the return to campus, that is still happening for a number of units who have been phasing in their return to on-site. So please remember that we have the resources on Blink for the return to campus checklist. Make sure people are updating their work location status form. So if you have not updated your work location status since July, you need to go and make that update. If your work location status has changed, even though you've changed it since July, you need to go and make that change. You need to always make that change when something changes with your work location to make sure that that's always up to date. Additionally, there is information on Blink about the flexible work arrangement policy and guidelines, information about training and professional development that we are offering, as well as the fact that we've added additional offerings for supervisors and managers to be able to give more opportunity for them to engage in the return to campus training, because we know that not all of them were able to attend our first several sessions. And so we are still rolling out content to make sure everybody has the information needed for this. The other key thing is, if you have temp employees in your area, temp employees through TES, make sure that you're including them in your communications around return to campus, because they're working in your department. So they would work with your department on their work arrangement, on when your department is returning to on-site, if they've been hybrid or remote. So make sure that you're including them in those communications. Next slide. So this is a key component of what Angela was talking about earlier. So we know that at least 88% of our campus employees are fully vaccinated, but we only have consent for and compliance for approximately 82 to 84%. So we have to close that gap, because there could be someone who hasn't consented to share their information in MyChart, and they haven't submitted an exemption or deferral, and that means they're not compliant. And we don't want to discipline anyone if we can avoid it. The goal is for everyone to be in compliance. So if you look on the screen, the top square means you haven't completed your consent. So you may be looking in your MyChart messages and you're like, Terry, I did this, I'm done. No, you're not. You have simply opened the message, but you have not completed the process. So you need to click on that message. Click on the subject header. Click on one of those words, consent to share COVID vaccine information. Click there. It will take you to another page. On that other page, it will have information for you to review, and then you can decide whether you want to consent to share your information. And you say, yes, I approve. And then after you click, yes, I approve, you have to then click submit, and then you are done. And then when you go back and look at your messages, if you've completed that process, your consent to share COVID vaccine information will have a green check mark. So see the difference between the top and the bottom. And some of you are probably thinking, why is she baby stepping this for us? You would not believe how many folks don't see the differentiation between the two checkboxes. So we want to make sure it's very clear, because we don't want to continue sending out these sort of, hey, heads up, you haven't been compliant with the process. Hey, heads up, when you think you've done something and you feel like you've been targeted. We don't want to target you. We just also don't want to discipline or get to the point of firing anyone when it's just a function of getting in compliance. And that is by either giving consent for your vaccine status, or by submitting your exemption or deferral and then responding to Cedric's request. So the other thing we communicated about last week, and I know we got a lot of reactions from a lot of folks, why am I getting this message? I've done everything that I was supposed to do. Well, a number of people received communications from Cedric where Cedric gave them their file number. They did not reply to Cedric's message. Instead, they sent Cedric a separate message with a separate subject heading. And in some cases said on the subject heading, here, or documents, and didn't include any further information for Cedric to be able to identify them as someone they'd already communicated with for an exemption or deferral. So that delays processing time. And that means when we get the updated list from Cedric on where people are in the process, you don't show compliant. So that's why you're getting communications from us. It's key that you follow their instructions to the letter by replying to the email, by uploading the documents as they tell you, by submitting it in the form they tell you. If they need a PDF, you have to send a PDF. You can't send a picture. You have to send it the way they need it, because they are processing thousands of requests. Just our location alone has more than 1,000 requests. So if you can imagine, up and down the system, every single location but one is using Cedric. They really need you to follow those instructions for timely processing. So please, don't get frustrated with our messages. Just know we really, really, really just want to do everything we can to get compliance before we get to the point next week of sending out notices of non-compliance that are followed in the flow chart and the policy that then lead to discipline. We don't want to go there. The other thing for supervisors is there's the supervisor dashboard. Supervisors should be checking this dashboard every single day. So this is another way for a supervisor to interface with their HR to find out exactly what should be communicated to an employee, and then communicate that to the employee so they're getting it wrapped up in a circle so they know exactly what they need to do to make sure they get compliant with the policy if they're showing as not compliant. If you aren't on a UC San Diego worksite, make sure you're on VPN. If you're having connection issues, you have to be VPN'd in order to connect to the supervisor dashboard. But it is key to look at that. What we built into the dashboard includes your symptom screening or the symptom screening for your staff. So for those of you who get sick of looking for the emails on the symptom screening and how folks are doing, you can actually see symptom screening in the supervisor dashboard and sort of at a glance to make it very simple for everyone interfacing with it. We're trying our very best to make this process as simple as possible. But again, we're going to exert as much effort as we can on the front end through this week to try and get as many people compliant as possible. And then next week, we'll actually start issuing the notices of non-compliance to do that final push. Because like I said, we don't want anyone to end up losing their job over not having engaged in this process. So with that, I'm going to turn it back over to Hallie, and thank you all for listening.
All right, thanks a bunch, Terry. Next up, we're going to hear from Executive Director of Transportation Services, Josh Kavanaugh, for an update on the light rail and some other transportation topics. So, Josh, it's all you.
Great. Thanks so much, Hallie. It's great to be with you all today. And boy, has it been an exciting couple of years on campus. We've been working furiously on the campus transformation and really putting our strategic plan as a campus into action. And we're seeing the physical manifestation of that across the campus. So in the campus strategic plan, we set 3 goals for the campus transportation. That our campus would be a destination. That everything we do is going to be about enriching the student experience, and that our built environment helps to spark research and innovation. So when you work with an operational guy like me, then we need to translate that into sort of actionable items. And the way that that translates for us is the idea of activating and enlivening the campus. This idea that we're going to become mixed use and have transit-oriented development, great public spaces, really building out the housing capacity on the campus. We want to make sure that we have a healthy and sustainable campus. And boy, have we appreciated the university's commitment to that over the last year and a half. And so that, of course, plays out in the context of COVID with creating great open spaces where we can meet and be together and collaborate without being in an indoor environment. But it's also about prioritizing pedestrians on campus, encouraging active transportation, making sure that this natural beauty that we have across the UC San Diego campus is preserved, and that we really find the balance in there that allows everybody on campus to enjoy that experience every day. And then, of course, strengthening our programmatic relationships on campus. These are the ways that we help folks through the built-in environment and through the program of the university to engage in collaboration to help create and innovate. And we'll talk just a little bit more about some of the ways that these translate then into action. Next slide, please. So this is a great project, and I was delighted to get to be a part of it. This happened last week during the Triton Weeks of Welcome, or TWOW. And if you recognize this space, this is across from the Student Services building, sort of an unused lawn space along Rupertus Way. And we gathered to put the three principles into action. We wanted to activate and enliven the campus to create a healthy, sustainable space and to strengthen programmatic relationships. And so campus planning, transportation services, student affairs through TWOW collaborated to invite students out to theme and paint this outdoor furnishing. And I was over at the lawn today, and my goodness, that place was hopping. Every table was full, every chair was full, and people were there, whether it was relaxing or studying or simply being with their friends and colleagues who they haven't been able to be with over the last year and a half. And it was a really vibrant space in a place that had not been very well used before. This is what the campus transformation is all about, and how we create these spaces that are really anchored in those three principles. Next slide, please. So now let's take a look at how the campus transformation and the arrival of the UC San Diego Blue Line trolley are reshaping University Center. And can we roll the video? So as we enter campus here, we're looking up Gilman Drive now, and beneath the guideway for the trolley, you see that beautiful new park that we'll be constructing over the next year and a half or so. We're coming up to the trolley platform. You've got Camp Snoopy on the left, the village of Pepper Canyon on the east. And we're turning now to look up Rupertus Way, that Ann Hamilton piece. And we just started laying the basalt pavers for that last week. We're now pivoting around to look to the Epstein Family Amphitheater. That will be in place to welcome everyone back to campus next fall. And I'm so excited for the opening season there at the amphitheater. We just had our first concrete pour for the amphitheater by the way. Spinning around now to come back down Rupertus, that Ann Hamilton piece will extend all the way from the trolley station out to Russell Lane. And we're looking through now again to Pepper Canyon Housing and to Warren Field. So Concordance, that piece by Ann Hamilton, will be completed at the end of spring quarter, at which point we'll be able to reopen Rupertus Way and have that perfect connectivity between the light rail station opening November 21st on campus and University Center. So let's look at some of the ways then in which the arrival of light rail paired with the overall campus transformation is really catalyzing the building program on the campus and the re-envisioning of what our campus can be. So Innovation Lane, which is the pickup drop-off area with shuttles to support the central campus station, formerly Pepper Canyon Lane, that'll be completed late this year. And so we're actually already using it with our shuttles today, and it will be fully operationalized for first rider November 21st. Then the Epstein Family Amphitheater, that will be the Pepper Canyon improvements where we're re-greening the canyon and then working on construction of that park canyon into January of 22 and then park over the following year. The Warren Field restoration is underway. That will be complete to where the turf is really taken in mid-February. Rupertus Way opening at the end of winter quarter, so spring quarter opening for that. And then the Epstein Family Amphitheater, which will have its opening season starting with fall quarter of 2022. Next slide, please. So as the campus continues to change, right, it gets a little bit more difficult for those of you who are just coming back to campus after having been away 18 months. It looks just a little bit different out there. And then for our guests who are coming in from the community, now that we've got that people pipeline in the form of light rail, we need to give them new and better ways to find their way around the campus. And so we're doing this both with some tactical moves and some long-term strategic moves. Tactically, we're adding graphical signage to our construction fences that provide some interpretation, for example, about that Ann Hamilton installation with concordance, and also providing supplemental wayfinding and campus information. At the light rail stations, both at the Central Campus Station and the UC San Diego Health Station on the East Campus, we'll have all the standard MTS signage, including real-time arrival information for the trolleys. So we're also, though, adding digital signage like the one you see on the right. And so this is on this screen looking very similar to some of the box signs that you see around the campus that help with wayfinding. But these are interactive touchscreen kiosks. And so when you come up and you tap it, you can see a campus map. You can zoom in to navigate. You can search in the map. You'll see a curated event feed of things that are happening near you. You'll see attractions or points of interest that are available near you. And of course, near and dear to my heart, you're going to see transportation information on there, real-time bus arrival information, including our very own Triton Transit. So another exciting project is the Waypoints project. And you'll see down in the lower left-hand corner there, one of our interns who worked on the project, Tommy Young, scanning one of the 250 waypoints that have been installed around the campus. And so we've completed the Central Campus installation. We're starting on the East Campus and Scripps Campus right now. And these are really simple interventions, but I think they're really meaningful. It's a sticker. You'll find them on light poles throughout the campus. It's got a QR code on that. And when you scan that QR code with your phone, it does a couple of things. The first thing it does is it opens the campus map, but it does more than give you a map. It actually centers the map on the point where you're standing on the campus so that you can put yourself in context on the campus. The next thing it does is it opens a dialogue that shows you some of the resources that are available around you. It tells you what campus neighborhood you're in. It tells you about the food options that are available near you and actually links out to some of those dining areas. It gives information about how to get around campus, some of the transportation options that are there. It gives information about buildings and services that are nearby. And it also gives you information about the wonderful public art that we have on campus in the Stewart Collection and beyond, and helps you find your way to those pieces. We think this is a great gap filler, if you will, in the campus wayfinding system, which addresses those big moves, but hasn't historically helped people anchor themselves in context. And again, I love it as a student-driven project. Tommy, along with one of our other interns, took this from a twinkle in my eye to a fully articulated project over the course of the summer. Next slide, please. So a little bit more about transportation then. And so at the Pepper Canyon, Central Campus Station, our UC San Diego shuttles from Triton Transit will be supporting that. Right now, we've got the Regent shuttle dropping off in there, but the Loop shuttles bidirectionally will be operating in Pepper Canyon beginning November 21st for First Rider. And we'll really be using this as our first and last mile connections to get people around the whole of the campus so that everybody on campus can enjoy what light rail is bringing. And when I say everybody, I mean everybody. Now, the East Campus for Health got the station. We've got the Central Campus station, but we've also modified the SIO shuttle so that it comes all the way to University Center, giving the Scripps community a one-seat ride and a short walking connection to light rail as well. So we're in the process right now. I was actually just out and visited the construction site this morning for a passenger load zone on Russell Lane. And so we're doing a new turnaround on Russell Lane, and that serves two purposes. One is it gives a place for the Lyfts and the Ubers and even just your spouse dropping you off or a roommate dropping you off, to be able to drop off in the heart of the campus. It also supports connections to light rail via Rupertus Way. The other thing that turnaround does, though, is it helps start to pedestrianize the University Center. And so University Center has been very car dominated. We're taking it back for pedestrians, especially as Rupertus reopens in the spring. And we have this massive amount of people that are flowing back and forth between light rail and University Center. We want to make sure that that is a welcoming and safe pedestrian environment. And this turnaround is an important part of that. In the temporary condition, we've restriped Rupertus Way to two-lane traffic to make sure that people can still access vital things in University Center while that turnaround is being constructed. And then we're doing improvements all along the Voight corridor for bicycles, for pedestrians. We've added we've added temporary lighting in there. We have permanent lighting coming later this year and at the beginning of 2022. We've got improved buffered bike lanes throughout there. We're actually getting protected bikeways on the Voight overcrossing for the first time ever, which is something that I'm just giddy about. And then the Voight roundabout, our first roundabout on campus, opened earlier this year. And we've got the permanent signage that's coming in there that'll help make that a very intuitive space for folks as they navigate it in the Voight corridor. Next slide, please. So finally, I want to address safety and security, because having the trolley come to campus is certainly a change of condition. And understandably, I've heard some anxiety on campus about that. And I got to tell you, I couldn't be happier to welcome Acting Chief Gregory Murphy back to UC San Diego Police. We're thrilled to have him back with us. And one of the first things he did as he landed on campus was establish a really great working relationship with his counterpart in the MTS security function. So we've got security cameras that are shared by both agencies at the stations. We've got gates. We're actually the only two light rail stations in the entire network that have gates on them because we've got some adventurous people here on campus. Let's, own it. And we want to make sure that nobody's getting onto those tracks overnight when the trains aren't running. We've got an MTS security team that's assigned to the campus station, UTC stations as well. And they'll be randomly riding back and forth as well to make sure that not only the off-board environment at the stations, but the onboard environment for our trolley riders are safe as well. So the two agencies work together really, really well. And so UCPD is going to be available to respond to law enforcement needs as they're called into the dispatch center. They're in real-time communication between the agencies, and they're collaborating on an ongoing basis. And so what we see at First Rider is going to be a great, robust, safe environment, but it is only going to get better. And that is something that I really appreciate the commitment of Chief Murphy and his counterpart to. And so with that, back to you, Hallie.
All right, Josh, that is like so much exciting stuff going on. So thank you so much for sharing all those details. So for our last update before we move into Q&A, I'd like to invite Jen Bowser, Chair of the Staff Association, to share some info about some upcoming fun events for staff to get involved in. So Jen, it's all you.
Thank you, Hallie. Good afternoon, everyone, and thank you for being here today. Twice a year, the Chancellor and the Staff Association host appreciation events to celebrate the wonderful contributions of our staff. Typically, these events occur over the summer and the holidays. In keeping with the tradition, we kicked off the staff summer celebration in mid-August by hosting an event at Dirty Birds for more than 100 night staff. And then the following day, we held a trivia session. A couple of weeks ago, we hosted our final cabinet conversation, which was with the Chancellor. If you missed that, you can find the recording on our website soon. That same week, we also hosted a virtual craft demo with Craft Center Manager Annika Nelson, where participants made thank you cards for their colleagues. We have some other fun activities planned in the upcoming weeks, starting with Triton Treats, and specifically cold brew and donuts for staff on Tuesday, October 12th. We do have time and locations listed here, but we're still working on those details, so stay tuned for more information. But later that afternoon, we'll be hosting another virtual trivia session. If you have not attended one of these of ours before, they're super fun, and we have prizes for the top point scorers. Thursday, the 14th, we'll be passing out ice cream bars in Town Square, starting at 1. And then we'll round out that week with virtual lunchtime karaoke on Friday. We'll have gifts for those who participate. And so if singing isn't your jam, that's okay. Just come watch your colleagues belt it out and have some fun. On behalf of the entire staff association, I'd like to say that we are all looking forward to reuniting with our fellow staff members, and that is the meaning behind the theme of this year's celebration, Reunited. You can visit the staff association's website, or you can follow us on social at UCSD staff for more information. Next slide. And the fun doesn't stop there. We will conclude our summer staff celebration with events we have planned during homecoming week that are just for staff. So in conjunction with the grand opening of North Torrey Pines Living and Learning Neighborhood, staff can pick up a game card on Tuesday, October 19th from 11:30 to 1 and visit booths around the neighborhood to collect stamps and win prizes. A staff favorite has been taking virtual photo booth pictures with their colleagues. So you can schedule a time on Wednesday, October 12th from 12 to 1 and show your Triton spirit for homecoming week. And then stop by the staff association table at the October 21st women's soccer game, and then the homecoming tailgate on the 23rd to pick up free swag. This year is the 25th anniversary of the Triton 5K, although it will be virtual. There are many teams that you can join. So visit the homecoming website to find a team and more information about all of the events planned during homecoming week. Thanks, Hallie. Back to you.
All right, thank you so much, Jen. Lots of fun stuff coming back, and it's exciting to be able to start to sprinkle in some virtual events and some in-person treat distributions. So that's great. So I'd now like to invite, we're going to move into our Q&A. So I'd like to invite our panelists back on screen to answer some questions. And as a reminder, I would encourage you to check out the Q&A at the bottom. There's lots of great questions getting answered in writing, and you might find one of your own questions in there and get some information. So check that out. So this first question, I'm going to send over to Chip, and I just want to read it verbatim because I just agree with a part of it. So can Dr. Schooley talk about the new variants, Lambda and Mu, the new Lambda and Mu variants in our community? And this person notes his updates are better than the news. And I have to agree with that. So Chip, what can you tell us about these variants?
They've been noted, and the Mu variant kind of peaked in June and seems to be gradually declining. It's like the Lambda variant, a little bit less susceptible to immunity induced by the vaccines we're using, but still quite susceptible to the Pfizer and Moderna and Johnson & Johnson vaccines. So they haven't jumped the track, these three, in terms of immunity. And they don't grow as well as the Delta variant. So they're having trouble competing with Delta. We're obviously going to keep an eye on this. We don't want to have a variant that grows better than Delta, but is less susceptible to vaccines. So that would be, if I were the virus, the direction I'd go. But the less we let the virus grow by having more and more of us vaccinated, the less chance it'll have to play around and look for an out like that.
Yeah, it's a good reminder. Thank you, Chip. All right, so this next question I think might have a couple answers. So the question is, if you do not have COVID-19, but do have a common cold, should you stay home? Can you work from home, or should you take leave? So I'm wondering, maybe Angela, if you want to speak to common cold symptoms, right? They're pretty similar to some of the COVID symptoms. So how might somebody deal with that? And then maybe Terry, follow up in terms of kind of the employment side. What would this person do?
Yeah, no, it's tough because we've seen that often, particularly in vaccinated individuals and even the unvaccinated, the onset of COVID can be very mild, and sometimes it stays that mild, and it can look like a cold. It can look like allergies. So if they are new symptoms, the best thing to do is stay home and get a COVID test, and then see how you do over. And then, you'll get your results back, and you'll have a sense colds usually start to resolve fairly quickly. So we'd rather you stayed home, try and work. If you're feeling well enough to work, keep working, let your supervisor know the situation, but get a COVID test rather than coming to work. What we've got to all do is be willing. Sometimes we have a history of we want to work hard. We don't want to leave work for others. So we come to work sick. This is not the time to do that. You can do a lot more disservice, and it could be COVID just subtly looking like a cold. So please test, stay home. Terry, you may want to add how they.
Yeah, I just want to amplify everything that Angela said. If you are not feeling well, look, this was the case pre-COVID, but I cannot emphasize this enough in these times and forever in the rest of your future. If you are not feeling well, a cold can be contagious. Don't bring it and share it among your friends. That's not the kind of sharing that we learned in kindergarten. That's not what we're looking for, although we probably shared a lot of colds in kindergarten. That's not the point. Don't come to work. Do not come. Please do not come. Please do not come. Please go get a COVID test. Please isolate from folks until you know what you have. Now, as it relates to leaves that may be available to you, when you take your COVID test, there may be a number of things. If you are COVID positive, or if you've had an exposure or something like that, you may be able to avail yourself of the emergency paid sick leave, the 2021 leave that is available. You may also be able to utilize your sick time, your vacation time. We want you offsite. So we are going to figure out a way to have you protected to the greatest extent possible. There is still Cal OSHA leave. So don't forget that if you have COVID symptoms and you are required to stay home, but you are otherwise able and well enough to work, but maybe you don't have work that is remote work, then you would be eligible for Cal OSHA leave for up to 10 days. So don't think that I've got to come in because I've got to make sure I'm earning enough money for my family, thereby putting everyone at work at risk, and maybe even your family members, because you have now, left the confines of the room in your home. So please, please do not come in if you are sick. Do not.
Good reminder. Thank you, Terry. All right, Josh, here's a question for you. How do you think the Mid-Coast Trolley Extension will change the staff experience at UC San Diego? And another question tacked onto that I can remind you about if you ask the first one is, will the Hillcrest shuttle remain in service after the trolley is running?
Fantastic. We'll start with the Hillcrest shuttle question. And, yes, but I think is the answer to that one. We're going to take all of those buses and all of the service hours that we've got in that program, and we're going to redeploy them to where it makes sense to serve the Hillcrest community. So the wonderful thing about light rail, and this gets to how it's going to change the staff experience, is light rail doesn't get stuck in traffic. Unfortunately, all of those Hillcrest buses get stuck in traffic all the time. And so it doesn't make any sense to run duplicative service that really isn't competitive with the trolley from a speed and reliability standpoint. So what we're going to do is we're going to take all of that Hillcrest shuttle service, and we're going to redeploy it in a continuous circulator between the Old Town Transit Station, Washington Street Station, and the Hillcrest campus. What that means is, instead of having 30-minute connectivity, which is what folks have right now with the Hillcrest campus in La Jolla, we're going to have 15-minute connectivity, where we can have a bus meeting every trolley that's coming back and forth from La Jolla. So much more capacity, so much more speed and reliability for folks. Now, I hear a few minds, gears turning out there, but wait a minute, the shuttle is free and the trolley isn't. Well, the trolley is going to be to get us started, at least. We're really delighted to be able to sponsor the first 3 months of transit ridership for anybody that joins our Fast Pass program. Some people are joining right now and jumping on the bus. Others are going to hold on and wait until November, and I totally get that. But your first 3 months of transit access, 100% supported by transportation services. After that, we've got kind of a step down, but at the very worst, you're going to get 25% off of the retail rate because of our negotiated relationship with MTS.
Awesome. Thank you, Josh. And thank you for advocating, I think, for these good things for staff in terms of transportation. That's awesome. All right, Jen, question for you. So you shared all this great information about upcoming staff association stuff. So this person says, how can we get connected to the staff community and meet more people? I imagine there's folks who maybe started their roles here with UC San Diego over the past year and a half, some people working on site, some people working at home. So how do people get tapped into the staff association?
That's a great question. Thank you. So you can always go to the Staff Association's website or email us at staffassociation@ucsc.edu. We do have many committees, one hopefully that is of interest to you that you could join. And I mentioned all these events that we're planning, and we can always use volunteers for that. And I think maybe some staff don't know that we also have affiliate groups. So these groups have particular interest that they focus on. And so the one that I've been involved with since I began as a staff member at UC San Diego was the Staff Sustainability Network. But we have 10 in total. So you can go check those out. They have pages on Blink, but they're also linked on our Staff Association website as well.
Awesome. I'll also know you can start an affiliate group too. So if you look at the list of affiliate groups and you see something that you would like to build community around as a staff member, we are totally open to staff starting their own affiliate groups. So definitely
Good point.
And keep an eye out for the monthly Staff Association newsletter, because that's where you can get tapped into a lot of these opportunities.
Thank you.
Right. So now for a different subject, Chip, another question for you. This person wants to know, is there any danger in getting a booster? Why is there hesitancy to approve it?
There are a couple of issues with it. One is the people who generally look at booster shots think about it as trying to prevent you from getting seriously ill. And with this virus, so far, the vaccines, even the Pfizer vaccine, in people who don't have underlying conditions, keeps people from not all the time, but most of the time being hospitalized, and almost prevents all the deaths, again, except in people with these underlying conditions. So they're saying right now they're doing pretty well. We still need to vaccinate a lot of people who haven't been vaccinated at all, because they're the ones who really are at the greatest risk. As you saw the numbers I showed you, they're the ones in the ICU who are getting sick and dying. And we also have other parts of the world that haven't had access to these vaccines, and we need to make sure that these vaccines are available there too, from the standpoint of social justice and equity. Research about how they've been tolerated so far has looked really quite good. There's been very little evidence of any more reactivity than in the first two injections that people had last spring. And the level of immunity you get when you have this long delay between dose 2 and dose 3 really goes through the ceiling in terms of protection. So from the medical perspective, very little hesitancy. A lot of it has to do with kind of philosophy about vaccine utilization. And finally, I would say people aren't sure if additional vaccinations will decrease the shedding of virus by people who are vaccinated and really decrease the risk of transmission to others in the population. My gut feeling is that it will, because we see such a difference in the rate at which virus is cleared in the vaccinated people who get infected compared to unvaccinated people, but that hasn't yet been formally shown. So those are some of the things that kind of were discussed at these meetings last week.
Very cool. Thank you, Chip. Number of factors, it sounds like. So this is a question related to return to campus planning. So Terry, I'm going to send this one your way. This person asks, why are departments being given the freedom to decide whether or not to work on site versus remotely?
Well, that's an interesting question. The departments are best situated to know their operations and to know what work needs to be done on a day-to-day basis. Look, I know it's very frustrating for employees who feel like they know their job and they should be able to decide their work modality. But the basic answer is that the supervisors, the senior leaders, they're the ones who ultimately make the call. And for us employees who report up to them, we have to be okay with that, because that's sort of the nature of work life, right? Like you have a boss makes a decision. You may like it, you may not like it, but ultimately it's their call. So the best approach might be, instead of why do they get to make the decision, instead it might be, how can I help to keep them informed in their decision making so they know that we've come up with these great new ideas on how to engage with the people we serve, right? You may have come up with great, thoughtful, innovative ways to connect with folks that really have developed out a client experience that no one really knows about because you haven't communicated with your leadership about that. Do it. They can't read your minds. They need to know what you've thought of, what creativity you have. The other thing that people need to know and remember, there were a number of things that were slowed down, stopped, or changed over the last year and a half in order to either shift operational response for the pandemic or just how we served our clients to be safe in the face of everything that's going on. A number of those limitations can be lifted as the numbers have started to look really great on the pandemic front. We're not all the way there yet, but we are getting there. And so because of that, there are certain things that we may have stopped or slowed down that we can now ramp up again. And that might require some on-site presence. And you don't necessarily have to like it. You will have to do it though, if your supervisor requires it. And this is, I know, a really difficult thing for people who, I'm an adult, I should be in charge of my own life. Yes, and you also chose a job where someone else is your boss. And so unless you are the chancellor, someone is your supervisor on this campus, and you need to follow what their requirements are. But again, engage with them, talk with them about ideas that you might have. Don't just thumb your nose at the process and get frustrated and judgmental, because there may be a number of factors that are going into their decisions that you have no awareness of because of their responsibilities as leaders and supervisors.
Sounds like communication is key with this question, is my summation of your answer.
Indeed.
Right. Josh, so with more and more folks coming back to campus, students moving in, employees gradually returning to on-site work, what is the one thing that you wish everyone knew about transportation on campus? If you could just send a takeaway.
I've got to pick one. So
I'll give you two if you've got.
So the really big one is that you've got choices. I recognize that everybody is in a different situation, and we have childcare commitments or elder care. We have spousal employment to consider. Folks live in different parts of town. And so we've tried to provide a diversity of options for getting to, from, and around the campus that can respond to each of those different sets of needs and priorities that folks have. But beyond that, we've tried to make sure that whether it's in our daily parking program or some of the new flexible transit options that are coming from MTS, that we allow folks to make choices on a daily basis. Because I can tell you my situation in terms of childcare, for example, isn't the same day to day. And having that flexibility to drive when I need to drive and do a pickup after work and take the bus when I don't need to do that is incredibly helpful. So you don't need to be locked into a single decision either. We're here to help and to help you navigate the various options. And in addition, if you go to our website, we've got a reorganization of that, and you'll find a new Commute to Campus tab on there. And for our staff colleagues, you will find an item on that drop-down menu for Commute to Campus that is just for you. And so it's got all staff-centric transportation information, no more reading through things that are about students or things that are about faculty, even though we love both of those populations. It is all about our staff and the things that are there to support you.
All right, thank you, Josh. So I'm going to squeeze one more question in because I think this is just a really important one and a good one to leave things on. And so this question I'll throw to either Chip or Angela. So I'm just going to read it out here. Given the increasing risk of breakthrough infections, what do you recommend in terms of testing, masking, other measures for fully vaccinated folks in general? So this person says, should we be masking outdoors? Should we be getting tested after dining out or going to events? So just kind of some of those life behaviors. What advice would you give to fully vaccinated folks?
Dr. Socha is the one who goes to restaurants much more often than I. She's much more bon vivant. So let her handle that.
Oh, if that were only so true. But I think we all have to live life with being mindful of what we've been doing. So if you're going to a crowded situation, a lot of folks, even if it's outdoors, put a mask on, right? Be safer that way. When you're traveling, airports, big spaces like that, a lot of people, make sure you have a really good mask. That's where I think they N95 and KN95, a really good mask is a good idea because there'll be a lot of people and often it's crowding occurs in those settings. After a trip like that, test. Test when you get back, test 5 or 6 days and stay on top of your symptoms. If you're going to go visit someone in your world who they're very vulnerable, an elderly person, maybe test before you go to see that person because you're going to know you're going to be around them and you want to really take care of the people you love. So this is great that the campus has made testing so accessible and free. They're around these vending machines. We are stocking them every day, testing thousands of people. We are ready. We can absorb thousands of tests every single day. So if it crosses your mind, you may have been exposed, or not exposed in a setting that a little more vulnerability, just grab a test, get a test 5 days later, just take care of yourself and pay attention to symptoms. I think that's the best we can do. And then use those masks, use them a lot. You're moving around outdoors, you're going to malls, you're going grocery store shopping, wear a mask. It's easy enough to do. Take the times when you have your mask off to those you're around and that they're taking care of themselves. That's the way I'm trying to live. It's not a perfect world. We all may eventually, we'll have some vulnerabilities, but it's the way to get back to living.
Very practical advice. Thank you, Angela. So with that, I'm going to wrap things up today. I want to share the details of another upcoming town hall before we do. So if you have questions related to events and event planning and you want to hear the latest news on that, you can join us at our events town hall. That's going to be on October 5th at 2:30 p.m. So we'd really encourage you to join us for that. You can find the registration link at returntolearn.ucsd.edu. You can find a recording of today's event on that same website. So just thank you for being here. Extra thank you to all our panelists for sharing your expertise, and we hope to see you next time. Thanks so much.